guys, I'm glad you're joining me here. In this lesson, we are going to be talking about pertussis, which is also known as whooping cough. Whooping cough is a very, very contagious respiratory infection. It's actually caused by the organism Bordetella pertussis, and you can actually see that in the photo here. And what happens during pertussis is that the bacteria actually attach to the cilia, which are the little teeny tiny hair-like things that line the upper respiratory system. And this causes damage and inflammation to the airway. And the crazy thing with whooping cough is that the symptoms can actually last up to 6 weeks, which sounds like a total nightmare to have a kid coughing for that long. The great thing is that pertussis can be prevented with the DTaP immunization. This stands for diphtheria, tetanus, and pertussis. And this vaccine is given at the ages of 2, 4, 6, and 15 months. And then it's given again between the years of 4 to 6. Now, you may be thinking, hold on just a second, I thought it was called the Tdap. So you've got the Tdap, and then you also have the DTaP, which I've talked about. Well, the Tdap is what's given for adolescents and adults, whereas the DTaP is used in infants and kids. In your assessment, there are 2 different stages that you want to be on the lookout for. The first one is the catarrhal stage, which is basically just like an upper respiratory infection. So you're looking for symptoms like fever, runny nose, and a mild cough. The second stage is called the paroxysmal stage, and this is the one that really stands out to people. And this is when the cough progresses. So patients will experience these really intense coughing spells where they have a bunch of really short, rapid coughs that are intense, and then they're followed by a high-pitched whooping sound, which is where we get the name whooping cough. These spells tend to be worse at night, and they can actually be so bad and the coughing is so intense that they actually cause vomiting and they can fracture ribs as well. And like I said before, it can last up to 4 to 6 weeks, so it's pretty exhausting. And I just want to make a really quick note, sort of the patients that we are really the most worried about are our infants. They can develop pneumonia and their airways are actually still pretty soft. So the intense coughing can cause a lot of damage there. They can have apneic episodes, which can be really scary, and they can also be life-threatening. So just be extra vigilant with your assessment for infants, making sure that you're looking out for any signs of respiratory distress. Patients who have pertussis or whooping cough need to be on droplet precautions. And our nursing care is really focused on supporting that kid's respiratory effort. So they may need to be on humidified oxygen. And then we also want to do simple things like making sure they're in a good position, like elevating the head of bed to support their efforts. Antibiotics are going to be given as well. The most common one that we give is azithromycin. And always, 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 patient education is super important. We need to prepare caregivers for the length of this illness, that they could be having sleepless nights for quite a long time, and then also making sure we talk to them about the immunization. Your priority nursing concepts for a PEDS patient who has pertussis should be immunity, infection control, and oxygenation. Okay, so let's just take a second to go through your key points for this lesson on pertussis. First thing you need to know is that it is a respiratory infection. It's also called whooping cough. It is very, very contagious and it is caused by the organism Bordetella pertussis. It is preventable with the DTaP immunization, and this is given at 2, 4, 6, and 15 months, and then again between 4 and 6 years, and then kids and adults may need boosters as they go through life. There are 2 stages to the disease. The first one pretty much just looks like an upper respiratory infection, and the second is the one where the cough progresses and you get that classic whooping cough that is associated with this diagnosis. Our nursing care is really focused on supporting their breathing and monitoring their breathing, and then also giving antibiotics. Don't forget about your patient education, and we're going to be focusing on preparing the parent for the length of illness and then also making people aware of the importance of immunization. All right, you guys, that's it for our lesson on whooping cough. Make sure you check out all the resources that we have attached to this lesson. Now go out and be your very best self today, and happy nursing.